Several Bay Area counties announcing they're ready to go. Some may bring back those mass vaccination sites that we saw earlier this year. ABC 7 News reporter Stephanie Sierra is tracking new developments. She's in the newsroom for us. Steph?
Yes, Dan, the last major work group meeting has just wrapped up before the state will finalize its implementation of CDC's guidance. And we're told COVID booster shots will likely be rolling out across most Bay Area counties by next week. And for some pharmacies like CVS, starting today.
In the final stretch of the COVID booster timeline, California is just hours away from adopting the CDC's guidance, giving the green light to counties across the state.
Recommendations, I'm sure, will be provided to the respective governors over the next, 24 hours.
Stanford infectious disease physician Dr. Grace Lee is a voting member on the CDC's Advisory Committee on Immunization Practices. The state is moving forward with a plan that will advise counties how distribution will work to prioritize anyone 65 and older, long-term care facility residents, and people with underlying medical conditions or who are at high risk, like healthcare workers.
High risk can be interpreted as a pretty broad category. Does this mean essentially anyone who feels at risk can go and get the shot?
My understanding at this moment is that similar to what's been done in the past, it'll be self-attestation at most sites.
Self-attestation means you don't need a doctor's note to get a booster shot, but simply attest to the fact you meet the eligibility requirements. UCSF's Chief of Emergency Medicine, Dr. Maria Raven, is concerned some may abuse that.
Depending on people's judgment about what their own risk is, I definitely think there's room for people to overstep and for it to be a little bit of a free-for-all with boosters, and that may happen.
ABC 7 confirmed all 9 Bay Area counties will be working with medical partners to open a network of vaccination sites ranging from doctors' offices, clinics, to pharmacies. In San Francisco, the health department plans to administer 25,000 doses per week across 100 sites that will be within a 10 to 15-minute walk in every neighborhood.
The fact that we now know the vaccine doesn't need to be stored at negative 80 degrees in a special freezer, it makes distribution much easier.
Meantime, in Marin County, a large indoor vaccination clinic is aiming to reopen by next week.
It won't be a mass vaccination site. There'll be multiple people getting vaccinated. Again, we're aiming for 1,500 people today.
Preparations are underway to reopen the San Mateo County Event Center as a mass site within days if smaller run clinics become overwhelmed.
We can turn it around in a matter of a few days.
Most counties anticipate peak demand will last for about a month as health departments work to get doses to those eligible groups. But Dr. Lee really stressed there's no need to rush out today to get a shot if you're not past that 6-month mark of your second dose among those priority groups. And thankfully for this rollout, supply here locally will not be an issue. Stephanie Sierra, ABC 7 News.
Yeah, Steph, let's talk a little bit more about the self-attestation. Now, how strict are these clinics and pharmacies actually going to be?
You know, Dan, the assumption now is not very strict. We know even before this guidance came out, people have already been getting additional doses at local pharmacies or directly with their provider. But Dr. Lee was quick to point out the list of what's considered high risk is going to be continuing to change. And the bottom line is, if you feel you are at risk, whatever your situation may be, you can just show up and attest to that and we'll get the shot.
Interesting. All right, Stephanie, thank you.